I'm Dr. Matthew Gertch, Harvard-trained physician anesthesiologist for Massachusetts General Hospital and founder of Protect Your Tube. Every year, more than 50 million intubations occur worldwide. Protecting a patient from the compressive forces of biting on an endotracheal tube significantly decreases patient harm by preventing negative pressure pulmonary edema and interruptions of oxygenation and ventilation. These harmful adverse effects can result in significant healthcare costs to both patients and hospital systems. The majority of airway providers currently use rolled up 4x4 medical gauze and tape to create a bite block that can be wedged in between the back of a patient's molars. A recent study took 40 random partially used rolls of medical tape in a hospital and cultured them to determine the cleanliness of an object being placed into a patient's mouth. Over 80% of those rolls of medical tape were positive for a combined 36 different types of bacteria and fungi, 16 of which were pathogenic. We developed the Protect Your Tube bite block to give airway providers a clean, pre-packaged, ready-to-go bite block that reliably protects endotracheal tubes from biting forces without introducing bacteria and fungus to the oral cavity. It has a hard inner layer to protect the tube and a softer outer layer to protect the teeth. Protect Your Tube bite block can be pre-attached to the endotracheal tube in one of two ways. One, simply slide the endotracheal tube through the inner lumen and lock into place. Or two, remove the circuit adapter and pass the pilot balloon and endotracheal tube through its inner lumen, lock into place, and then reattach the circuit adapter. The Protect Your Tube bite block has a unique locking lever that allows the bite block to be attached to the endotracheal tube. The bite block can be securely attached at the top of the breathing tube below the circuit adapter, and once intubation is complete, it can be slid into place between the lateral incisors and back molars. Many novice airway technicians and students get so excited when they pass the endotracheal tube through the vocal cords that as they do so, they overly aggressively insert it, resulting in damage to the carina or main stem intubation. The Protect Your Tube bite block can be locked into place at the anticipated depth of insertion, thus preventing overly aggressive insertion with intubation. When doing so, mark the anticipated depth with the distal part of the bite block. Then, when the tube is in place, slide the bite block the rest of the way to the lateral incisors and back molars. And when you are ready to extubate, simply unlock the bite block and remove the endotracheal tube through the inner lumen. It can be removed as one unit, or if the patient is forcefully biting down, the endotracheal tube can still be safely removed and the bite block shortly after. So the Protect Your Tube bite block has been uniquely designed to work with even the most rigid of stylets without interfering with its insertion or removal. Lastly, the Protect Your Tube bite block takes up minimal real estate in the mouth, allowing for easier passage of other monitors and instruments into the oral cavity. For example, temperature and transesophageal echo probes, gastric tubes, and Yankauer suction. The Protect Your Tube bite block is an FDA-approved Class 1 medical device that has no ferrous components and no latex, that's patent pending currently in the United States and internationally. It's currently available in two sizes. Size large fits endotracheal tube sizes 6.5 to 8. Size medium fits endotracheal tube sizes 5 to 6. Why do I use the Protect Your Tube bite block? Because it's clean, fast, efficient, and it sure makes my job easier. For information on how to place an order for your hospital, contact us at protectyourtube@gmail.com or go to our website www.protectyourtube.com.